Today, I want to show you something pretty fascinating, how your face can give you clues about what's happening inside your body. But before we start, let me say this right away. Please don't go diagnosing your spouse, your friends, or your family after listening to this. Trust me, that's a terrible idea. Nothing starts an argument faster than saying, "Hey babe, I just figured out why you have puffy eyes and dry skin." Don't do that. Use this information for yourself, not as ammunition at the dinner table. All right. Let's get into it. One of the biggest things I've learned after years of working with patients is that the body leaves hints everywhere. Your skin, your eyes, your hair. They can all reflect what's going on metabolically and hormonally. For example, thinning hair on the top of the head is often linked to high DHT levels, which is a strong form of testosterone. That usually means the body is converting too much testosterone into DHT. Things like pumpkin seeds, green tea, and zinc may help balance that process. Now, if you're losing the outer edges of your eyebrows, that can sometimes point to a sluggish thyroid. Low iodine can be part of the picture there. Bloodshot eyes? A lot of times that's connected to stress on the liver or blood sugar issues. Years ago, when my diet was full of junk food and processed carbs, my eyes were constantly red. If the inside of the eyelids looks irritated or feels gritty, that can also be a sign of insulin resistance. Basically, your body struggling with too much sugar and carbs. Dark circles under the eyes are another big one. People think it's just lack of sleep, but often it's tied to blood sugar problems and high insulin levels. You see this a lot in people heading toward prediabetes. And those puffy bags under the eyes? That can mean fluid retention, blood sugar issues, or kidney stress. One of the fastest ways to wear out the kidneys is chronically high sugar intake. Notice a pattern yet? A lot of these signs trace back to the same root problem. Too much sugar, too many processed carbs, and constant insulin spikes. Let's talk skin for a minute. Oily skin and acne are often hormone-related, especially elevated androgens. In women, that can sometimes show up as PCOS. In teenagers, it's incredibly common because the diet is usually loaded with processed food, seed oils, sugar, and not enough nutrients. Honestly, when I was a teenager, I wish someone had explained this to me. It would have saved me years of frustration. Red cheeks or rosacea can sometimes be connected to chronic stress and elevated cortisol. But there's also often a gut component involved, an imbalance in bacteria or inflammation. I've seen people improve dramatically by cleaning up the diet, adding fermented foods like sauerkraut, and using natural anti-inflammatory herbs. Now let's talk about flaky skin around the nose and ears. That's often linked to an imbalance between omega-3 and omega-6 fats. Most people today are overloaded with omega-6 oils from fried foods, processed snacks, soybean oil, corn oil, and fast food. Meanwhile, they barely get any omega-3s. The result? Dry skin, inflammation, brittle hair, irritated eyes, all kinds of issues. Adding more fatty fish, cod liver oil, or algae-based omega-3s can make a huge difference. Another common issue, cracks at the corners of the mouth. That's often tied to a vitamin B2 deficiency, especially in people eating lots of refined carbs like bread, cereal, crackers, and pasta. Cold sores are another interesting one. That's a virus that tends to flare up when the immune system is weakened. And one of the biggest triggers I've seen over the years is stress, especially emotional loss. Major stress events can wake up viruses and even trigger autoimmune problems in some people. Now, here's something most people never connect. A round, puffy face can also reflect insulin issues. Years ago, even when I thought I was eating healthy, I was constantly snacking. Fruit, peanut butter, granola bars, all the typical health foods. But I was eating all day long, constantly raising insulin. Once I cut the snacking, lowered the carbs, and started intermittent fasting, my face leaned out, my energy improved, and a lot of inflammation disappeared. That's really the big takeaway here. Your face can give you clues, but the deeper issue is usually metabolic health. High insulin, processed foods, chronic stress, nutrient deficiencies, those are the things driving many of these symptoms. And the good news is, your body is incredibly responsive when you start giving it what it actually needs. Eat real food. Cut back on sugar. Stop snacking all day. Get healthy fats. Sleep more. Lower stress. Spend time outside. Simple things. But they work. Subscribe to the channel and stay healthy.